Hello, this is Dr. George Bitar, and we are here in the OR Masterclass to discuss the benefits of the ELIXIR MD cellular treatment after surgery. It has many benefits that are photomodulated. First is to improve the healing by decreasing the swelling, decreasing the bruising, and improving the lymphatic drainage. How does it do that? The photomodulation has the light penetrating the skin at the 599 nanometer wavelength to affect the mitochondria and the cellular mechanisms. It decreases the swelling, it decreases the bruising, and it improves the lymphatic drainage. So the way it improves the lymphatic drainage is it acts on the smooth muscles in the lymphatic drainage system. That in turn stimulates the removal of the waste products, the proteins, and thus decreases the swelling in the tissues. Also, at the cellular level, it affects the cytokines, specifically IL-6 and tumor necrosis factor A. By affecting those pro-inflammatory cytokines and decreasing them, it decreases the inflammation, it decreases the bruising, and speeds up healing and decreases the pain and the recovery. And so therefore, our post-op protocols are: we treat the patient with the cellular repair mechanism immediately after the surgery, post-op day 1, post-op day 3, post-op day 5, post-op day 7, and post-op day 10. So the patient being committed to this treatment ensures that they're going to have not only a better result, but a speedier result and a more pleasant result.